He kōna I purangi tēnei nā te reo irirangi o Aotearoa.
SpaceX Launch Director, go for launch.
You heard that call out. The launch director has given that final go. All systems are go for launch of Falcon 9 and the CRS-30 mission.
It's the 21st of March 2024 and a rocket launch is about to take place at the Kennedy Space Center in Florida.
230 seconds.
This commercial resupply mission, CRS-30, which is run by SpaceX for NASA, is headed to the International Space Station, the ISS. On board is about 2,800 kilograms of cargo, cruise supplies, spacewalk equipment, bits of hardware for the station, and a bunch of different science experiments, including one from New Zealand, a small cube called Lucy.
2, 1, ignition, and liftoff at a Dragon return to Space Launch Complex 40.
Kia ora, nau mai haramai ki te ao hurihanga. Hello and welcome to Our Changing World. Ko Claire Cannon tēnei. Today, we're blasting off into space with some New Zealand science. Later, we'll hear from a Nelson-based engineer who's developing AI systems to help make good decisions around keeping people safe in space. But first, while it might be launching from Florida, Lucy the Cube's origin story begins in Ōtautahi, Christchurch, and with Associate Professor Dr Sarah Kessans of the University of Canterbury's School of Product Design, who's hoping that Lucy is the first step towards a commercial venture. A biochemist by training, Sarah did a PhD in plant-based vaccines. But her research focus took a turn when she applied to NASA's astronaut program.
I was really fortunate enough to get through from 18,000 initial applicants down to the top 50. So went through all of the interview process through astronaut selection and really just became enamored with the value of microgravity research and the research that's going on the International Space Station.
Now, I did ask her about the astronaut program and the different interviews she had to do, but Sarah signed an NDA, so she said she couldn't get into specifics.
They want to find out about you as a person, so your skill sets, your background, how you get on with people. We got to do some pretty fun things. But just that learning about what is actually going on the International Space Station. What is the value? You know, NASA spends billions of dollars to keep the space station up and running, to send astronauts to the space station, to do this research. All the researchers who are sending their science to space, what value are they getting out of it? And getting to learn about that on a real intimate level was... Man, as a scientist, it was just the absolute most exciting thing to be able to do.
The next step was to narrow the field from 50 to a top 12, but Sarah didn't make that cut. She got that news on the 26th of May 2017, one day after Rocket Lab launched their first test orbital rocket from Mahia Peninsula.
And so that was sort of the start of the aerospace industry here. And so I figured if I wasn't going to be a NASA astronaut, how could I help develop the aerospace sector here in New Zealand? And so utilizing my biochemistry background and my love for all things aerospace, that's sort of how I got into this.
And where biochemistry and aerospace cross over neatly is studying how biological molecules behave in the microgravity experienced in low Earth orbit. That's from about 100 kilometers up to about 2,000 kilometers up.
If you have an International Space Station, you have satellites, those are still orbiting around the Earth because we have the gravity that's keeping them in orbit. But when we're talking about microgravity in low Earth orbit, essentially in the International Space Station, the ISS is essentially in free fall. And so an astronaut inside the International Space Station will be floating around. And all of the experiments will also be floating around. And that's really important for the biological research that we're doing. You don't have sedimentation forces, you don't have flotation forces, and critically, you don't have what's called convection currents.
Maybe you've seen some of the videos of the astronauts in the ISS. I love watching them. Like they can just let something go and it hangs in the air. Or they squeeze water from a bottle and it forms a bubble that they can kind of just gulp as it floats past. As a biochemist, what's interesting to Sarah is the lack of sedimentation, flotation, and convection currents. So, heavier things don't sink to the bottom, lighter things don't float to the top, and there's no heat-related movement. Hot air doesn't rise, cooler air doesn't fall. This sets up a stable, fluid environment. And this is key for what Sarah wants to use it for, protein crystallization. Now, there are a couple of reasons you might want to make a protein crystal, but one is to figure out the exact shape of this teeny tiny molecule, which you can't see under a microscope. So step one is make a protein crystal.
And then we shoot them with X-rays, and then lots of math, and then we get this atomic level structure.
If you're a dedicated Our Changing World listener, maybe this is ringing some bells. Last year, we travelled to the Australian synchrotron in Melbourne, a massive facility where electrons are sped up and then manipulated to produce intense beams of high-energy light. And some of the New Zealand researchers we met at the synchrotron were there to shoot X-rays at protein crystals they had made to figure out the protein structure. And often, the crystallization step is a difficult one. What you'd like to do is to gently convince a bunch of protein molecules to assemble nicely into a uniform crystal lattice. This will then give a lovely repeating scatter pattern when you shoot X-rays at it. And some proteins behave quite well when you ask them to crystallize. Others, not so much.
So what we're really focused on is those tricky cases where you can't get a very good protein crystal and you don't yet have a really good structure of that protein.
Sounds like a hell of a lot of effort, right? You produce your tricky protein, you send it to space, you make a crystal, you get it back from space, you bring it to a synchrotron, you blast it with X-rays, you do a bunch of maths, and only then do you get your answer. Why bother?
A really good example is the COVID virus. Everybody remembers the spike proteins on the outside of the COVID virus. Well, we can use protein crystallization to look at the exact structure of those spike proteins. And if you know that exact atomic level structure, you can develop antibodies, antivirals, vaccines against those specific proteins.
And it's not just about figuring out ways to defend ourselves from viruses either. There are plenty of therapeutic drugs that are proteins too, and we need to know the structures of those. People have been sending science experiments to space for a while now. There's even a bioprinter that's been used on the ISS to test printing of 3D organs in microgravity conditions. So there's quite a bit of evidence already that proteins do tend to crystallize better in microgravity than on Earth.
But it's really been in a low throughput manner thus far. So when you're doing these experiments on Earth, you can either have a liquid handling robot or an undergrad and lots of people doing a lot of the pipetting. You need a lot of different conditions before you find sort of that one chemical, composition of the soup that you put the protein in so it will crystallize. And so you need a lot of those conditions before you find the one that's perfect. And so we can do that really easily on Earth. Up in space, getting an astronaut to give you hundreds of different conditions until you find the one that's perfect. It's a little bit harder to get.
I mean, if they'd accepted her, Sarah would have had the pipetting skills. But not all astronauts do, and they really don't have the time. The goal for Sarah and her team is to develop something they can send to space which will run many, many experiments independent of astronauts. Essentially, setting up a little protein crystallization lab that in the future she hopes people will pay to use. And when designing this lab to be a space payload, to be transported to and from the space station, it must be as small and as light as possible to minimise cost. They are 2 years in on a 5-year funded project, but a key milestone was that launch in March 2024.
You're looking at a live view of Falcon 9 and Dragon awaiting liftoff from Space Launch Complex 40, or SLIC 40, at Cape Canaveral Space Force Station in Florida.
So that was New Zealand's first mission to the ISS. The facility was named Lucy, a 10 by 10 by 10 centimeter, tiny little laboratory in a box, along with a second payload that had a range of protein crystallization experiments from about 12 researchers around the country. And so we were able to get some really great data, both with the protein crystallization, and so understanding in our hands, can we also see that you can get higher quality crystals in microgravity versus ground control, and we did. And then also actually getting some flight heritage of our hardware and software systems.
And once Lucy got to the ISS, the job for the astronauts was pretty simple. Unpack, plug it in.
And then we took it from there. And so everything else we were controlling from the ground.
Right, and you actually have it with you.
Yes, I do.
So this is something that's been in space?
It has, yes.
Okay.
So New Zealand's first payloads, yeah.
Yeah. Well packaged.
Yes. I mean, she doesn't need to be so packed up, but she's quite precious to the team and I. So yes, this is Lucy.
How many experiments are running in this?
So this is just a single experiment that had about 200 different what we call nanowells. We just had a single protein and a single protein crystallization condition. But in the future, in the size of the experiment that we have in these what we call microfluidic chips, we'd have the opportunity to have about 200 different protein crystallization conditions in this sort of footprint.
Right, so Lucy is a kind of pilot test run, see how it works.
That's exactly
and then can kind of
correct.
scale it up a little bit. So the next iteration, will it be larger in size? Like it would be bigger than this 10 by 10 by 10?
Yes, correct. So the next platform that we're developing is a very large shoebox size. So it's as we're going into what we call the express rack system on the space station. So it's a single locker size. If you have a pair of gumboots and you were to put those in a box, that's about the size of the payload that's going up next year.
Remember, the plan is that someday in the future, this will be a commercial enterprise. Here on Earth, you can try and crystallize your protein yourself in the lab, but you can also pay a company to do it for you.
So there are terrestrial protein crystallization services, oftentimes associated or at least near a synchrotron light source, so where the actual X-ray beams are located. And so looking to partner with those crystallization services, so adding additional services to what is offered terrestrially.
How much is that going to cost?
That's we're working that out at the moment. So we do have a really great partnership with Axiom Space and understanding right now that sort of market validation. So understanding what customers pay for protein crystallization services on Earth and what the value add of going to microgravity is going to be, and obviously what our launch costs are. So again, keeping that mass and that volume as low as we possibly can. So the nice thing about what we're doing is that the facilities that we're developing will really only have to send a fairly low mass and low volume. And so if you're only sending, for each experiment a couple grams, that really brings the cost down. But we don't have a full set price yet that I can advertise, but we're trying to make it as analogous to a terrestrial service as we can.
So the next test iteration, the big shoebox, will go up next year on another cargo run to the ISS.
If this one goes well, we'll have a second launch in 2028, which will also go to the International Space Station. And then once the space station is decommissioned, partnering with Axiom Space, so we eventually want to have a permanent facility on their commercial space station. Having been continuously manned since February 2000, the ISS is on its final countdown. It will be deorbited in 2030, essentially boofed off its orbit into Earth's atmosphere, where most, but likely not all of it, will burn, break up, and vaporize. This will be done over a remote part of the Pacific Ocean. The ISS will be replaced by commercial space stations. NASA's term for this future is the low Earth orbit economy, where, just as Sarah is planning, different companies will pay to make use of the unique conditions that microgravity provides. And NASA has made a deal with Axiom Space, the company that Sarah works with, in which Axiom can dock modules to the ISS as a kind of stepping stone for the assembly of its own commercial space station. The station design on their website includes research and manufacturing spaces, as well as a windowed observatory. But just to bring us back down to Earth for a second. Shooting X-rays at a crystal isn't the only way to figure out a protein's structure. So I wonder if Sarah is concerned whether advances in other methods will disrupt her plans. There are a range of other techniques that you can use to get structures of proteins. So protein crystallization is one way to do that. NMR is another. Cryo-EM has just been making leaps and bounds in being able to get these atomic level structures as well. Programs like AlphaFold will also predict a three-dimensional model of a protein structure. So there are a range of applications and a range of techniques that you can use to get these atomic level structures. But what I think is really important is having that suite of available technologies in order to get them. I think there will always be an opportunity to utilize protein crystallization. So we recognize that the market's going to continue changing, but we think we should be able to provide a value add with the service that we're creating.
Their focus right now is on that early initial find out what your protein looks like stage, which, will be the start of any drug development pipeline. At the other end of the pipeline, there's been research that's shown that creating crystals in microgravity of existing protein therapies can be helpful. An example of this is a drug called Keytruda, which is used to treat some forms of cancer. It's an antibody that helps immune cells fight back against cancer cells, so a protein. In 2019, the company that makes it, Merck, sent it to space.
And they were able to crystallize this in microgravity and get this beautiful, uniform, sort of homogeneous crystalline formulation. And so the value of that is in a crystalline form, Keytruda can be injected as opposed to utilized in an IV treatment. So if you have Keytruda as an IV treatment, you have to go into a hospital and it's hours-long therapy. Whereas if you have an injectable form, essentially that can be administered at any sort of GP clinic sort of a thing. There are a lot of companies now that are really cottoned on to the value of this and the potential value of this. And so there are a lot of companies that are looking at providing a service for crystallizing these pharmaceutical formulations. And so the platforms that we're developing will also be able to do this.
Now, Sarah and I, two biochemists having a yarn, have been focused on the application side of all this, the protein crystallization itself. But looking at Lucy and considering the epic journey of this 10 centimeters cubed lab, it's clear that a huge amount of this project has been solving engineering problems. And that's where the collaboration between the University of Canterbury, Arizona State University, and two Christchurch companies comes in.
That's been one of the most fun parts of this project is the team that I get to work with. Because as a biochemist, I came into this really not understanding hardware fabrication, not understanding what a printed circuit board was actually doing in electronics. And I've had the really great pleasure of not only learning about all this, but having our engineers learning protein crystallization. And that the real value of what we're doing is that the team and the skill sets and the expertise that we're really building, that capability building here in Aotearoa to be able to do this, not only, like I said, for protein crystallization, but a range of different microgravity research opportunities.
That was Associate Professor Dr. Sarah Kessans of the University of Canterbury. Having astronauts on the ISS for the last 25 years has also taught us about the effect that being in space has on the human body. But with limited access to medical help and supplies, how do you choose the right people to send to space? How do you adequately equip them for anything that might go wrong? And how do you make sure they have the right medical skills to deal with issues that arise? There are a lot of decisions to be made. And that's what our next story is about. I caught up with Dr. Brian Russell at a scientific conference in Christchurch to learn more.
Yeah, hi, I'm Dr. Brian Russell. I live in Nelson and I do academic research out of the Auckland Biomedical Institute at Auckland University and also the Sports Performance Research Institute of New Zealand out of AUT. And I develop and commercialise human medical devices and also AI decision support. And they come together. The devices typically collect the data and then we use AI to analyse that, and we use that to make decisions, whether it's diagnosing somebody or helping somebody in the field perform better or not get into accidents.
And you just gave a really interesting talk about something that you're currently working on, which is about how to make decisions to try and keep people safe in space, basically. Yep. Because space is a dangerous place for humans to be.
It is. It's got some unique challenges. It's somewhat related to whether you're a fireman, a soldier, or a professional sports person. You've got similar levels of performing of jobs. So it's kind of like being a worker, but you're in space. But then you've got some other physical challenges and also medical challenges. And there's like 5 five main stresses for space around microgravity, radiation, and then as we plan to go back to the moon, hopefully, and then further to Mars, then there's going to be less resupply. So what you take is what you've got. The talent and knowledge of the people you take is what you've got. And the radio actually takes longer to reach Earth and go back again, so it's harder to hold a conversation. And also the shoebox size equipment we take for the first aid kit and treating anything that's more than first aid, there's a huge amount of computation done before they leave to understand what's the chances of different diseases and medical conditions occurring, what resources, whether it's a band-aid or drugs, and then what few instruments we can take to actually help diagnose that in treatment. So that's where the AI helps with the selection of the people. It helps with the planning of what to take, what's probably going to be needed, and then once they're up there, the AI tools actually help them basically increase their skills as a doctor, help them diagnose different things, how to treat them, give them different options.
And so how do you go about developing this decision-making AI that will help you with those three different phases, as you said? Like first, you're selecting the right person to go up there.
Yeah, that's a great question. So really what we do is we spend a lot of time with medical doctors, initially at NASA. Now a lot of those doctors have gone out into the commercial space companies such as VAST and Axiom Space. So understand how would they select somebody, how would they plan to put in the medical kit, and then how would they look after somebody if a particular condition happens. So you've got selection, planning, and then admission. And once we understand how they do their processes and then how they think, so a lot of my work is actually interviewing them and chatting with them of how they think, and I've got to turn that into what's called a computational model. So once I know how they're making those decisions, then I have to match a cognitive stack on top of that, which hopefully either reinforces what they're doing or in some cases replaces what they're doing. And so medically, that would be take an observation, understand that relative to the health of the person, make a differential diagnosis, and then do a treatment plan, and then all of that is feedback. Did it work? If it didn't work, maybe it was the wrong diagnosis, or maybe it was the wrong drug. So once we have that understanding of how we do a medical diagnosis, or how we would use medical diagnosis to select the right people to fly, or calculate the incidence rates of different diseases for that particular person given their medical history and what has to go into the medical kit, all of those decisions can be made, and then we put that into a software tool. We have to use it, so we have a user interface just like any software tool, and so then those systems get put into those AI gets to put into different systems. It may be a selection system, so people can go onto a website and actually apply to be an astronaut. It may be an internal system for, say, VAST or Axiom or NASA, that they're using it to actually just the engineers and doctors are figuring out what to put into the first aid kit, or it may be a software system that's flown actually in the spacecraft, and the astronauts themselves are using it to, say, do a diagnosis and figure out how to treat a particular issue.
And in terms of the basics of like how you design this kind of AI, are we talking about like a large language model that you're then inputting all of this data from the different companies, and you're saying, you know, if you get this information, I want you to tell me what the best next step to do is?
Yeah. So before ChatGPT 3 came out around 2023, it was a lot of maths called Bayesian reasoning, which is kind of like an algebra of how you and I make a decision. Like, is it going to rain tomorrow? We'll take into account, did it rain yesterday, and a few other aspects, and we'll kind of put our thumb in there and guess. But post GPT-3, large language models now have been shown to not only be easy to talk to, because you don't have to use a specific word, they can take the general meaning of what you're asking, and also it can do this reasoning. So just by itself, it can't do a very good job. There's typical issues such as hallucinating, so making things up just to try to give you an answer, and it may not have specific knowledge. So a lot of the knowledge we use are actually NASA standards. So there's 30 years of research into those NASA standards. It's very specific. It's not available generally, so the AI models haven't been trained on it because they can't get access to it. So we put those standards into a structure that allows the LLM to read it easily, and then it's called a multi-agent process or chain of thought. We break down how to do a particular task into steps, and then we'll use what's called a prompt. So that's how you'd ask the LLM what to do. So we tell it what it's good at, we tell it what data has available to it, and then we let it ask the question or decide what the next step is, and then we give it some trade-offs like you're only allowed to ask 10 questions. This is a simple example. And so it's got to now, in 10 questions, figure out how to do the diagnosis. And what it can do is say, I've only got 10. If I've asked 8 and I've only got 2 left, what's the most valuable thing I can ask you? Because I've only got 2 left. So if we give it this restricted resource concept and we tell it the intent and we give it all this expert knowledge and we pull it together in a prompt, then the AI or the LLM can do a very good job of solving that one particular step. And then we break it into lots of steps, and then it can be very accurate in that one step, and when we put it all together, now we get an overall accuracy. What's very difficult is to figure out, did it give us the right answer? And so sometimes it can give us the right answer through some of the steps and then make a mistake. So the other advantage of this chain of thought process or agentic approach is we can figure out at what step is it making mistakes, and we can fix that one step rather than be a big black box. It works sometimes, doesn't work other times. So if it doesn't work, myself and doctors will sit down and figure out how to tell it something else or what to ask it to think about so it does a better job. We're not going off and training the LLM. That's been done for like $100 million by OpenAI or somebody.
Right, yeah, and that strikes me then as really powerful if you're saying, hey, look, our first aid kit for a space station is this size and it's got to be under this weight, and you have to pack like the maximum beneficial potential first aid components within those really strict constraints.
Yep. And that's really difficult. So we use AI to figure out, say, your medical history, and given that you're now going to go into space, so the human body's going to go under these stresses, what is the likely incidence of different conditions? And then we look at the most probable incidence for you specifically and for, say, the other 3 crew, and then that will help us then figure out what should go in that first aid kit.
You mentioned a number of different companies there. Are you working with all of them?
Yep, also working with Axiom. I should state that both AUT and Auckland University are involved. The New Zealand Space Agency has funded or co-funded some of this work as well, and have been really instrumental in some of the partnering and international business development there. I've worked with Axiom Space and also Vast Space. Both of them are building space stations that are going to go up to replace the current space stations. So these will be privately owned space stations.
And traditionally, when we think of astronauts, we kind of think of like this really rigorous selection process where you've got the fittest, finest, most able-bodied people,
humans,
who are psychologically sound.
Yep.
Is that going to change when we have more commercial space travel?
Yeah, it's going to change. There's 2 things changing that. So when it used to be like Chuck Yeager breaking the speeds, sound of speed, and then going up in space quickly and coming down, it was super dangerous. That was a particular type of personality. Then when they went to the space station, that required a slightly calmer personality and a team worker, because you had to live with other people on the space station, and that's going to change again as we send people to Mars for 2 or 3 years. So there's a personality match to the mission, which is changing, and then as we go to commercial space, there'll be people that are older, and so our threshold for different medical conditions and physical conditions is going to get lowered, which actually makes all of this job even harder. So NASA takes tens of thousands of people and chooses 8 astronauts. We're going to have probably thousands of people and choose hundreds of astronauts. So there's going to be a lot more work to do with all this optimization we've just been talked about, and probably a lot more medical conditions that are actually going to occur, and they're going to occur more frequently as well.
Yeah, plenty of work for
it
you
gets
in the
harder.
future.
Yeah. And I think that's one of the sweet spots for AI, right? When AI can extend human expertise or increase volume of computation on a complex problem, that's a nice place for AI to solve problems for us, and that's what I like about this application. It's a really nice natural fit for AI, and extend both human performance here with a group of doctors having to do selection or what goes in the kit, and also extending the knowledge, skills and abilities of those people that are in space that need something to help them do their job better.
That was biomedical engineer Dr. Brian Russell, whose research and work focuses on human performance in extreme environments. This episode was produced by me, Claire Concannon. Production help was from Alan Rikers, and sound engineering is by Phil Bench. If you have any feedback or questions, you can email us, ourchangingworld@rnz.co.nz. Tēnā koe I whakarongo mai. Thanks so much for listening. I'm Claire Kincannon. Have a great week. Kia pai te wiki.